On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Long-Term Care Emergency Preparedness Educational Series, Who's at the Table? Understanding Incident Command and Team Roles. My name is Christine Bingman, and I will be your moderator for this program. Now, I'd like to introduce our speaker for the webinar, Joanne Atkins. She is a registered nurse and senior infection preventionist for the Patient Safety Authority. Ms. Atkins is a board certified in infection prevention and epidemiology and is a fellow of the Association for Professionals in Infection Control and Epidemiology. Ms. Atkins is a 2019 recipient of APIC's Heroes of Infection Prevention Award for Education. She is a member of the Association for Professionals in Infection Control and Prevention and has served on the Member Services Committee, the Sigma Theta Tau International Nursing Honor Society, and the Pennsylvania Association Directors of Nursing Administration Long-Term Care. Joanne, I will now turn the program over to you.
Thank you, Christine. Today we're going to discuss the basics of an incident command team, its functions, and the roles and responsibilities of the team members. An incident command system can be used at organizations both large and small, and it can even be used by just one person. If you have a small organization, the same person may fill multiple spots on the organizational chart. But remember, it is recommended that at a minimum, your staff are trained in the basics of an incident command system so that they can step into one of the roles if needed during an emergency. So here's our objectives for today: to explain the key roles of an incident command system and the 5 functions, understand the organization of the command center, and discuss the responsibilities of the incident command roles for the incident command team. The incident command system is used to command, control, and coordinate the efforts of individual agencies as they work towards the common goal of stabilizing an emergency. This is done in an effort to protect life, property, and the environment. The incident command system establishes who has the authority or who's in charge. It details the responsibilities of the members of the team, coordinates communication both internally and externally, and works to stabilize the emergency and coordinate the response to it. The incident command system uses principles that have been proven to improve efficiency and effectiveness and applies these principles to the emergency response. This system establishes who has authority, the role they fulfill in an emergency or a disaster situation, and the main goals are establishing control, coordinating communication, and ensuring safety. In an actual response situation, it is essential to follow the chain of command on site. So what are the key benefits of an incident command system? It establishes the chain of command for the response, and it is clear, defined, visible lines of command. It provides a manageable span of control. And what they mean when they say manageable span of control, that refers to the number of individuals or resources that one supervisor can manage effectively during an incident. The incident command system clearly delineates roles and responsibilities. It uses standard or common terminology to ensure communication. And it manages all communications at a scene through a common plan and has an established communications infrastructure. The Facility Incident Command is a practical, standardized approach for dealing with emergencies. It is not your usual quote-unquote same business as usual. It uses a common language that all affected facilities and the response agencies can recognize. Facility Incident Command is flexible and scalable to accommodate the demands of the incident and to optimize your facility's response. The incident command system provides the incident commander with a clear framework to help them structure, organize, and manage an emergency. It can be adapted to all sizes and types of emergencies, and it helps you deploy and use your resources effectively. It begins at the top and expands as needed by the event. Positions within this structure are activated and are dictated by the incident size or the complexity of the incident. As complexity increases, the organization expands, but only those functions or positions necessary for the incident are activated. The incident commander initiates the response, and that person sets the overall command and control objectives. The mission of the response is defined for all members of the response team through a clear understanding of the organization or facility's policy and direction. This includes an assessment of the incident from the current situation to projected impacts. To meet the overall mission or command objectives, individual sections of incident command will establish objectives as well as strategies to achieve them through clear tactics. Because emergency response is not business as usual, clearly defined objectives will allow your staff to focus on their role in the response. It also helps avoid duplication of effort or omission of critical actions. And then these objectives are documented in the Incident Action Plan. The Incident Action Plan is a written plan that provides personnel with direction for taking action based on the objectives identified, and it reflects the overall strategy for incident management while providing measurable strategic operations. Your staff need to be familiar with the requirements of the incident command system and know how to operate safely and effectively in it. And that applies both to those in a command role, part of the incident management team, and also to those who will be working under their command. So it is important, as we spoke last week in the overview, or last month in the overview, to make sure that your staff receive basic training in emergency preparedness and incident command. So who's at the table for an incident management team? Well, this slide shows the basic members of an incident management team, but depending on the size of your facility, one person may occupy multiple positions. And you do not need to activate all positions. You only activate what are needed for the incident. The size of the team is influenced by certain factors, including the type of the incident, the impact to your facility, and the span of control, again referring to the number of people one person can supervise. So the slide lists your basic command team, but I want to mention right now, because I've had multiple facilities and discussions with them tell me that their command team is always their administration. That is not always true, because if an emergency happens in the middle of the night that requires immediate response, depending on that emergency, your administrative staff may not be able to get in there to run the team. And that may then fall on your nursing supervisor and other staff that are present within the facility. So we're going to talk about these different members of the team. The incident commander is the leader. This is the person that activates and directs the response, and they establish the priorities and objectives of the incident command. They determine the size of the team and assign roles or section leaders. The incident commander approves both the plan and key actions, and they also are the person who coordinate with response partners, such as emergency EMS or law enforcement. The incident commander needs to be aware not to become overburdened or have too broad a span of control, because that can lead to ineffective leadership or failure of situational awareness. They need to use the team and their team members. So underneath the incident commander, they have what we call the command staff. As needed, the incident commander may appoint the liaison or public information officer, the safety officer, and the medical director or specialist. And that group collectively is what we call the command staff. The Public Information Liaison Officer provides reliable information to staff, visitors and families, the news media, and concerned other people as approved by the incident commander. They serve as the primary point of contact for the supporting agencies that are assisting the facility, and they also develop public information or messages that are sent out. This may be somebody in your public relations department, or it may be a social worker, someone along those lines. But remember, anyone can fill any role on the incident command team. Your safety officer ensures the safety of staff, residents, and visitors. They look and identify risks to the facility and monitor and correct hazardous conditions. They advise the incident commander about unsafe conditions and recommend corrective actions. And this person has the authority to halt any operation that poses an immediate threat to life or health. And then the medical director or the specialist. This is the person who oversees medical services and assists with the management of residents or injured staff. They are an advisor to the incident commander and staff regarding medical issues, biological or infectious issues, ethics, hazmat implications. They're the resident expert. Thinking of what we've dealt with COVID, your infection preventionist is your specialist who sits at the table of your incident management team. And then other sections are your general staff. This is your operations section, your planning section, your logistics section, and the finance and administration section. The operations section, these are your doers. These are the people that do the stuff. Your nursing, your dietary, your physical plant or maintenance, your environmental services. They handle key actions including first aid, search and rescue, fire suppression, secure the site, maintain food and nutrition. They coordinate the tactical activities, the hands-on activities that are consistent with the objectives set forth by your incident command. Your planning session are the planners, needless to say. They collect information, analyze, and report status information to the team. They gather that information and then they plan ahead. They make and revise action plans, and they're also the people that keep all team members informed and communicating. They provide for the continuity of operations. Logistics, I think of these as the radars. They get the stuff. They're the people who acquire the necessary staff, supplies, space. They also ensure preservation of essential services by making sure that all necessary resources are maintained. They maintain facility supplies, equipment, transportation, and also the labor pool when you need to activate your communication tree and get your staff in there. And then the people at the table, finance are the supporters. They track all expenses. They look at costs and expenditures. They track claims, activities, and personnel time, purchase supplies, and they maintain detailed records. They're the record keeper for this incident. And then they also perform payroll and other clerical tasks that may need to be done. But once your incident management team is in place, then the action planning begins. The incident action plan formally documents your goals or control objectives, the operational period objectives, and response strategy. There are 6 essential steps to incident action planning. You need to understand your facility's policy and directions, need to be able to assess the situation at hand, establish incident objectives, determine appropriate strategies to achieve those objectives, give tactical direction and ensure it's being followed, and provide necessary backup when that direction is initiated. So this chart I did just as an example of that. The incident commander sets the overall objectives for response and recovery. And once that person has established these overall objectives, then the team develops an overall strategy for each section. As your response evolves, needs and priorities may change, leading to revision of the objectives and strategies. So when you look at this chart, we have the incident commander who is establishing the major priorities or the incident objectives. And then once they're established, the section chiefs look at the strategies to meet those objectives, the major approaches taken. And then the third part is the tactics needed to meet that. And those are the specific actions. So when you look at the end column, the incident commander set to ensure the safety of residents, staff, and visitors because of a tornado. So the first strategy, the major approach set by the section chief, was to assess the building for structural damage due to that tornado. But for that to happen, the specific action is we needed to equip that assessment team with the appropriate PPE and tools to safely conduct that assessment. So your incident command center is the location where the team works during the incident. It's recommended the location be safe and secure and be equipped. It needs to be equipped with adequate technology and sufficient communication equipment, along with cell phones and radio systems, because we know that sometimes cell service in the midst of a disaster may not function. You also need to make sure you have a landline available. It should also be equipped with a computer and printer. And it's recommended that either an internet or TV for news source so you can see what's going on outside of your facility. They also recommend it should be easily accessible for food and also a restroom, needless to say. And then some of the items that are recommended to either be contained within that area or be easily accessible are basic office supplies. A lot of places recommend using a whiteboard to keep track and flowchart everything. You also need to make sure that it contains your incident command documentation, both electronically and in hard copy. Hard copies of the emergency response, the crisis communication plans, and also your telephone list, your contact list. It should also contain facility maps and floor plans to note the location of fire extinguishers, emergency shutoffs for utilities, that sort of thing. It should contain your facility emergency operation plans, including all emergency procedures. And it should also contain an emergency resource directory that includes important information such as contact information for staff, suppliers, and your emergency response and community response agencies. To have it all readily at hand so someone does not have to go looking for it. And of course, you have to keep it organized. You need to keep your supplies and files organized. Someone should routinely go through there to make sure that somebody wasn't taking items out of that area. Make sure it's easy to locate your documentation, electronic and paper copies of the incident command system forms, please. It's recommended to color code incident-specific documents to make them easier to find. And make sure you customize the documentation to your facility. I know there are facilities that have purchased emergency preparedness plans that are generic. Make sure that somebody has customized those plans to fit your facility. Or you may have received them from corporate, but they may be covering a facility range from 50 beds to 500 beds, or facilities that may not all contain the same specialty units. Maybe some facilities have a dialysis or have a ventilator unit that others do not. You need to make sure that your plan fits your facility. So some of the tools that we just want to review quickly are the organizational charts, FEMA's Incident Action Planning Guide, and of course, the IP contact information for PSA is on here. So these two slides, these two are just showing you the flow charts for an incident command team, an incident command center. The link at the bottom of this slide is from Kansas Healthcare Association. They have put together a nursing home incident command system guidebook that is very well done and is shared governance that you may want to take a look at. This has the link to FEMA's Incident Action Planning Guide, and I highly recommend you take the time to review that. And then, of course, you have your resources here at the authority, which are your infection preventionists. This slide has links to all those resources to help you pull them up if you so wish to review them. But I have two very good resources that are going to be on this call for, or this webinar, for the question and answer section. Jason Brown and Pamela Drake have graciously agreed to participate in these webinars and assist with the question and answer session, as they are the experts in emergency preparedness. I am an infection preventionist and we play a role in emergency preparedness, but these two people are definitely your experts. Jason is Director of Healthcare Emergency Management for the Public Health Management Corporation, and they work in cooperation with the Pennsylvania Department of Health to provide management and oversight of Pennsylvania's hospital preparedness program, and he brings over 20 years experience in emergency response and management. Pamela Drake is the Deputy Director of Healthcare Emergency Management at Public Health Management Corporation. And she is very experienced also in working with hospital and the healthcare industry, as well as government contracting and university settings. Along with being Deputy Director for Healthcare Emergency Management, she is also an intermittent agency representative and public health advisor for the U.S. Department of Health and Human Services. They are going to be participating in the question and answer session as the experts to answer your questions. So Christine, I'm now going to turn the program over to you.
Thanks, Joanne. That concludes the slide presentation portion of our program.
Jason, would you and Pam like to add any comments right now to the presentation while we're waiting for questions to come in?
Certainly. Thank you, Joanne. Good afternoon, all. I think one thing important to think about is after seeing the presentation you just went through, think about that your facility is guided on a day-to-day basis by policy and procedure. You have an emergency operations plan that guides you out when the situation grows beyond what that normal policy and procedure is. Your incident action plan is really that your way of capturing what are those changes to my plan and how am I communicating that to my staff. Just kind of putting it all together of what some of that terminology is and kind of how it plays into the day-to-day operation.
Thanks, Jason. Pam, do you have anything to add?
Sure. I think also along those lines of how Jason just phrased it, of thinking about your day-to-day operations, is it's easy to look at some of this material and get overwhelmed. So falling back on that, how do you run things day to day? What is the minimal way to change that while streamlining how an emergency is handled is probably the best way to look at this system as it comes to use in your homes, whether it's practicing during an exercise or a drill or responding to a real-world event.
Thank you. We do have a question now. Do you have recommendations on running drills or practicing your emergency management plan?
Early and often.
Another question for you. In preparation for any type of emergency management activities, do you recommend that the main players in your incident command team have their own binder with tactics in how to manage their responsibilities during an emergency management situation?
Yeah, I think that binder is very important. In the HICS, or Hospital Incident Command System, if you will, or in the FEMA ICS process, there are what's called job action sheets. Those job action sheets are really those details of what are the objectives that my position in this ICS org chart should be considerate of. The one thing to remember as we consider those job action sheets, all of those items that are listed on that job action sheet, ultimately the responsibility of that incident commander. So being able to delegate that those positions to others within your organization helps share that workload and complete the objectives that you have established.
I think also to Jason's point and looping back to the earlier question about exercises and his answer being early and often, using those job action sheets is a great way to have an exercise in which you have folks practice roles that they wouldn't normally fill, because it's, as Joanne mentioned during the presentation, there's that opportunity of something happens, it's an overnight response, and your nursing supervisor from night shift is the person that initially takes the lead until the incident is stable. Those exercises allow you to walk through those job action sheets in a much more low pressure way.
And to expound upon the first question of, how often, and, I would try and incorporate emergency preparedness into a lot of the activities that you have to do. I'll use fire drills for an example. You do those on a month-to-month basis to test the system, ensure that the audible signals sound, the visual signals sound, and that your staff respond to the immediate threat. But on a monthly basis, you have opportunities to extend that particular activity to a partial evacuation, whatever the case may be. How do I notify the families? You have the ability to build different pieces of your response into that monthly drill that could be part of your ongoing update and exercise program. Remember, our goal is to identify what is the operational impact that drill had upon you. So even participating in other, whether it be through your healthcare coalition, your local community, participation in the exercise isn't really what your regulatory body is looking for, and really isn't beneficial to your facility. It's playing in that exercise to the point that you have an operational impact, and being able to document that operational impact, whether it was something that you've done well in your ability to respond to that event, or something that you would change if that event were ever to take place at your organization.
Thank you, Jason. This webinar will soon be ending, but we have time for maybe one more question, and this is from Alan. He asks, Jason, isn't there an annual requirement at the least to have an exercise or tabletop? And if we could make that response brief.
Certainly there is. CMS has the final rule issued for all of the different suppliers and providers that receive CMS funding, and there is an annual requirement for a community exercise, is how it's worded.
Thank you, Jason. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation and/or certificate of continuing education, please feel free to direct any inquiries to Shelley Mixel at shmixell@pa.gov. This concludes our webinar.